A reverse shoulder replacement is basically a procedure for someone that either has a rotator cuff that is no longer fixable, and then sometimes they have some arthritis with that as well. The rotator cuff is essentially gone, so we can't do a regular, what we call anatomic shoulder replacement. So a reverse is basically just that. Instead of the ball being where you would normally be, it's actually, we go in and we resurface the socket and we place a ball where the socket would be. Now we do the same thing with the shoulder bone. We basically put a socket where you would normally have a ball. And this becomes the new joint and it functions as so. So you might ask yourself, well, if I don't have a rotator cuff, how does this work? And that's the neat thing about the reverse shoulder replacement is it works without a rotator cuff. It uses your deltoid. So we have a lot of neat new technology that we use in performing this procedure. We have new bone ingrowth types of metal, which is very advantageous. And then as far as recovery, it's typically a one-night stay in the hospital. We get you home the next day. You're in a sling typically for 6 weeks, doing some very light exercises at waist level. And then the neat thing about a reverse, or another neat thing, is there's minimal physical therapy with that. But you have to meet certain criteria in order to be a candidate for a reverse. And we can definitely determine that for you when you come visit us in the office.
Call the Shoulder and Orthopedic Institute today at 405-330-8847.